thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. COVID-19 cases in Middle Georgia have gone down. In fact, there are no COVID-19 cases at Coliseum Health System. So this morning, I'm talking to Dr. Hoffman, who's going to talk more about the COVID-19 vaccinations, the importance, and how everyone should prepare as the new strain approaches. Good morning, and thank you so much for joining us.
Good morning. I'm happy to be here. Thank you for having me.
Absolutely. So, Dr. Hoffman, what are some things that people should know before getting the COVID-19 vaccination?
Yes. So the COVID-19 vaccination, let's see, things that I think are important to know. So number one, the COVID-19 vaccines are all very effective. So I'm talking about Moderna, Pfizer, and Johnson & Johnson. Moderna and Pfizer are probably modestly more effective than Johnson & Johnson, but I would say, get whichever one you want to and feel comfortable with. So Moderna and Pfizer are both about 95% effective in protecting you against COVID-19 infection, which is amazingly effective for a vaccine. Most vaccines are nowhere near that effective. We're happy with 50-60% efficacy. And they're even more effective at protecting against severe infection, hospitalization, and death. So your chance of being, severely ill or dying from COVID vaccine, or dying from COVID infection just plummets once you're vaccinated. So I think that's important. The other things that are important to know, the vaccine is very safe. So there's been a lot of talk about possible side effects, and it's true that we've seen a very small number of cases of myocarditis, which is heart muscle inflammation, predominantly in young men under 30. However, it's still a whole lot safer, like orders of magnitude safer to get the COVID shot than it is to get COVID-19. Even for young people, the COVID shot is way, way safer than getting COVID itself. So I think that's important. Lastly, I would say that, you should expect that you may have some side effects from the COVID shot, and that's really a sign that your immune system is doing its job and that the vaccine is working. I'm not saying that if you don't have a severe reaction that it's not working, but if you do have a reaction, meaning, you might have a sore arm, you might have a day or two of fever, you might feel tired for a couple of days. Those are all normal reactions to the vaccine, and it doesn't mean that you got COVID from the vaccine. That's impossible. And it just means that your immune system is reacting and gearing up and responding the way that we want it to. That's all.
Okay, so let's lay out some facts, Dr. Hoffman. There have been talks, that I've seen on social media and stuff where people are saying, I got the COVID-19 vaccinations. Now I don't have to wear a mask. I can't catch COVID. Is it true that people who are vaccinated, is it less likely, they won't spread COVID-19, or is it saying, okay, I got vaccinated, I can't catch COVID? Can you clear that up for us?
Sure. So getting vaccinated greatly reduces your risk of catching COVID. It doesn't make it 0%, but it reduces your risk by probably close to 95%. So it greatly reduces your risk of getting COVID. It does not completely eliminate COVID. We do see a few breakthrough cases in vaccinated people, which for the most part are mild and don't result in the person being hospitalized, which, that's the main goal, is to prevent hospitalization and death. We don't want people to get sick, but if you get a flu-like illness, that's not the end of the world. If you end up in the hospital on a ventilator, that's a big deal. So you can catch COVID, but the likelihood is much smaller. And you can spread COVID, but again, the likelihood is much smaller. We think that getting vaccinated reduces your risk of being an asymptomatic carrier by roughly 80%, give or take.
Okay. So let's talk about very quickly, this new strain is the Delta variant. Obviously, it's very, very contagious or whatever. So just talk to us about, people that aren't vaccinated at this point, how imperative it is for them to go ahead and get vaccinated as this new strain approaches,
Right. So I think there's a bit of a sense right now that, COVID is over, we can all go out and get back to our normal lives. And it's true that case counts have gone down dramatically. And we are thrilled about that. Believe me, we are thrilled to not have a lot of COVID patients, or at the moment, any COVID patients in the hospital. However, I think it's important for people to understand that there is this new Delta variant that's probably 50 to 60% more contagious than the old variant. And unvaccinated people are going to be very, very vulnerable to this Delta variant that's beginning to spread in the United States. So it's already spreading in states with low vaccination rates. Missouri comes to mind. I know their hospitals are already getting overwhelmed. And I think any area where, the majority of the population is not vaccinated, we're likely to see another wave from the Delta variant. And so I'm concerned mostly for unvaccinated people that, in the next couple months, case counts are likely to go up again, and people who are not vaccinated are going to be, definitely at risk.
All right. Well, thank you so much, Dr. Hoffman, for clearing those things up that a lot of people have been wondering. So I really appreciate you for coming on the show and just talking about the importance of these vaccinations.
Oh, it's my pleasure. Thank you so much for having me.
Hey, are you experiencing algae, mold, dirt, or pollen around the foundation of your home and your driveway? If so, call Reed's when you're in need. Reed's Power Washing Service has next day service available. Select service less than 2 hours. You're thinking, Reed's Power Washing Service is homes, that's all we do. Nah, we do it all. Driveways, fences, porches, and we clean your rides. So call that number on your screen today and get you a free quote.